My name is Marlene King. I was diagnosed with breast cancer in 2008 and had a lumpectomy, a couple of re-excisions, chemotherapy and radiation. And about 3.5 years later, I did a mammogram and it was back in the same breasts. So my surgeon suggested that I did a mastectomy, and I decided to do a double mastectomy and had the implants placed. And about 11 months or so later, something didn't seem right, so I went to my oncologist and he said, let's do an x-ray. When he did the x-ray, he says, call me back in and says, Marlene, we need to do a PET scan. Come to find out that the cancer had metastasized my breastbone, both of my lungs, my liver. And so now that was in 2012, and at the same time, that same summer, my mom was also diagnosed with metastatic ovarian cancer, 2012. So not only was I a patient, I was also being a caregiver as well. Difficult task and time. My doctor and I my oncologist and I have a very good relationship. We started out together in 2008, and he has been on the journey with me through this entire time. Each and every time something has to be done, it's myself, my oncologist, and my husband that's there to be a part of this, figuring out what's the best way to do my care. My oncologist has been awesome. We talk about what medications they are that could be used. We talk about the side effects. We talk about what side effects I would want and what I wouldn't want. For example, I do not like nausea and vomiting, so he knows that. So one of the things that when we are looking at care, we look at what's going to cause the least amount of nausea and vomiting so that it will be beneficial to me and yet make me feel better at the same time. Kind of an oxymoron, because taking any kind of treatment doesn't really make you feel any better. But nausea and vomiting, if I don't have to do those two, I'm okay. You know, I think it depends on the oncologist and it depends on the patient. There are some patients who will take things and move it forward. And there's some who wants their oncologist to make the call. There's some oncologists who wants to work with their patients to make it a team effort. And then there's some who wants to make the call themselves. I honestly don't know, but I think education first and foremost for both the oncologist and for the patient. The patient understanding that it's their voice, it's their body, and they need to understand that they are the patient and the doctor is working for them and with them. And the oncologists need to understand that the patient is who they need to listen to and what they have to say and how they say it and whether or not it's going to be a fit. And I think that's the most important thing. Sometimes oncologists and patients just don't fit. So you have to find the right oncologist and the right patient in order for them to fit. And that takes some work. And sometimes people just don't want to do the work. Sometimes it means you have to go to a second oncologist or a third oncologist and then decide which one makes you as a patient feel better. Which one makes you as a patient feel empowered and feel as if this doctor, this oncologist, is going to take you to the next level to where you want to go. So it's double-edged sword, but it can be worked out.